Coronavirus has shaken the world, with more than 2.5 million passings and 115 million cases affirmed. BBC Panorama's Jane Corbin has scoured the globe to track down the best instances of systems for fighting the infection. I have covered COVID for as long as a year. Presently my main goal was to discover from worldwide pioneers and senior well-being authorities across 4 landmasses what their needs were in handling the infection. What has arisen unequivocally for me are 4 key regions which have been best in containing the spread of the infection and forestalling passings. Early and compelling activity to control lines and observing of appearances. Testing, following everybody associated with being contaminated. Welfare support for those in isolate to contain the infection. Effective administration and predictable and ideal public informing. Nobody can profess to have everything right. Yet, the means recorded beneath feature a few strategies from around the world that have demonstrated successful. Piece them together and you have the diagram for a pandemic playbook, a manual for overseeing future irresistible illness flare-ups. Stage 1. Preparation. Stanley Park lives in Seoul, South Korea. At the point when he went to get his little girl, Ju Yeon, from the air terminal, he welcomed her not with an embrace but rather with a cover and a jug of cleaning shower. For Stanley, this isn't his first experience of a pandemic. He recollects the obliteration and dread that the MERS flare-up brought to East Asia in 2015. It's an encounter his nation has gained from, with the public authority unveiling 48 changes to reinforce well-being crisis readiness and reaction. These have paid off. When COVID hit, authorities had the option to level the plague bend rapidly, without shutting organizations or carrying out stricter stay-at-home limitations broadly. After her appearance from Atlanta, Ju Yeon finished an exacting 14-day isolate at her folks' home, downloaded an application that tracks her developments and got 6 registration calls from the specialists. She viewed her isolate so appropriately that she didn't go to the nursery, in the event of some unforeseen issue. From the very beginning we set up careful anticipation measures to stop something very similar happening again. History rehashing the same thing, Prime Minister Chung Sai-Kian said. Stage 2. Test, track and follow. It's trying right now. I have no clue if the patients I see have COVID or not, David Hodges, a GP from Northeast England, told Panorama in March 2020. We may have many cases where absent. As cases took off in front of the primary lockdown in late March, and with assets extended, the UK government, which had been leading contact following until this point, quit testing locally. It had the ability to test just in emergency clinics. The public authorities' proper test and follow program was dispatched in May. Most nations in East Asia began contact following in January. In South Korea, medical clinics like Yangji, in the Gwanak region of Seoul, were assigned to deal with COVID from testing to therapy. Here, individuals don't have to enter the structure, they're tried at arm's length in an extraordinary completely fixed corner. The medical clinic measures all its own tests nearby and the outcomes are normally accessible inside 4 or 5 hours. In the UK it can require a day or more. As it were from the emergency clinic, a track and follow group circles back to each speculated case. The group can be criminological with the detail and approaches MasterCard and cell phone information. It screens CCTV all through the locale, sending groups out into the local area to scour the roads when it sees something that worries it. Executive Chung Sai-Kian took individual charge of the circumstance before the nation even had an affirmed instance of COVID, offering need to the 3 teraseconds, test, track and follow. By applying that technique we've accomplished a decent, significant outcome, Mr. Sai-Kian has said. The loss of life in South Korea, a nation of 52 million individuals, remains at 1,693. How does the test and follow framework work in the UK? The UK government says the testing framework has proceeded to develop and it is doing all that it can to improve it. Stage 3. Quarantine support. Making individuals stay at home is the primary explanation we've had the option to contain COVID, says Usha Kumari, a local area well-being specialist in Kerala, India. Usha is one of 30,000 certified social well-being activists, known as Asha laborers. Usha's job has been to guarantee every individual who needs to self-seclude in her fix does as such. She gets their shopping, gathers their medication and anything they may require, with the goal that they don't leave their homes. The help for those secluding doesn't end there. Local area kitchens have been providing up to 600 free suppers to individuals self-separating at home or in medical clinic every day, and psychological wellness administrations have been offered since the beginning of the pandemic. Monetary guide has been given and, sometimes, bills were briefly frozen. In the UK, it wasn't until September that an instalment of £500 was offered to those self-segregating. In any case, in the initial 4 months of the UK plot, 66% of candidates were dismissed. As indicated by a scientific advice group for emergencies report delivered in September, under 20% of individuals in the UK who were needed to self-confine, completely isolated. What number of individuals are being paid to self-confine? Presently, the UK government's extending qualification for the help instalment. It says 4 million individuals could qualify. Kerala's well-being pastor KK Shailaja learned significant exercises 3 years prior managing the lethal Nipah infection and has applied those exercises to handling COVID. She demands that by guaranteeing support for those self-disengaging, authorities had the option to control the spread and hold its emergency clinics back from being overpowered. With a populace of 35 million, Kerala went from having the most noteworthy number of cases in India in March 2020 to having among the least COVID-19 passing rates on the planet. Stage 4. Protect the old. Toward the beginning of April, GP Lisa Federal started testing in care homes in the old town of Tübingen, in the Baden-Württemberg province of Germany, to keep the infection out and to permit guests. The town's City Hall leader, Boris Palmer, thought, "We need to develop an uncommon insurance safeguard for individuals who convey the most noteworthy danger." He had seen the effect of the infection in Italy and Spain on the more established segment. "These are the older individuals, so we need unique assurance for them." Mr. Palmer utilized his nearby financial plan to focus on care and backing for the town's older populace, including a sponsored taxi administration, free covers conveyed to homes and unique shopping hours. It implied the town's university hospital gotten less COVID-19 patients and wasn't compelled to drop other operations. What are the consideration home visiting rules in England? In contrast to the UK, where London, Edinburgh, Cardiff and Belfast settled on every one of the significant choices, Germany, with its government framework, permitted every one of its states to choose locally how to react to the infection. The older have been among the biggest losses of the pandemic, and, especially in Europe, those living in care homes. In spite of the fact that guests were prohibited in UK care homes directly toward the beginning, there was analysis that testing was moderate. It wasn't until the 15th of April that it was declared by the UK government that all individuals released from medical clinics into care homes expected to have a test. By July, in any event 20,000 consideration home inhabitants in England and Wales had passed on from COVID-19 since the beginning of the flare-up, as per the Office for National Statistics. With regards to nursing homes, they're a weak gathering and that ought not have been a shock, says Professor Dale Fisher, a specialist in irresistible infections who was shipped off the focal point of the flare-up in Wuhan, China, in February 2020. "I believe it's been clear where on earth nursing homes weren't given consideration, the losses of life there were huge." Stage 5. An inoculation system. In excess of 26 million individuals in the UK have gotten at any rate one portion of a COVID immunization, a piece of the greatest vaccination program the nation has at any point dispatched. While well behind world pioneer Israel, which has so far completely vaccinated the greater part its populace, the UK has had uncommon accomplishment with its immunization program. The UK's prosperity is generally down to a gigantic exertion in arranging. The Department of Health and Social Care started arranging a mass immunization program before there was even affirmation of the main COVID-19 case in the UK. In the late spring, the public authority marked an agreement for 100 million portions of the Oxford-AstraZeneca antibody and 30 million dosages of the Pfizer-BioNTech immunization. It's an alternate story in Europe. Arranging began later and the rollout has been moderate. Just 8% of individuals in Europe have gotten an immunization so far, contrasted and 36% in the UK. The UK's antibody bargains were struck 3 months before the EU's. Who is the one who planned the Oxford immunization? Immunization stop hits Europe rollout as COVID cases rise. The circumstance is more terrible across the creating scene. While essentially the entirety of Europe and the Americas have started inoculation crusades, just a small bunch of African nations have. In South Africa's Cape Town, Michael Kuta is one of the numerous individuals in the municipalities who elected to partake in a preliminary attempt by Dr. Linda Gale Becker for the Johnson & Johnson antibody. Michael doesn't know whether he has gotten the immunization or a fake treatment, however he says, as far as he might be concerned, it's great. It's the lone possibility that I need to get the infusion for the pandemic. To live, he says. My family actually need me. Numerous less fortunate nations are depending on conveyances from COVAX, a plan drove by Gavi, the Vaccine Alliance, which intends to guarantee access for all to COVID antibodies. The UK is probably the biggest donor, giving almost £500 million. South Africa has joined to the activity. Notwithstanding, an immunization procedure should be a global exertion. In nations where admittance to an immunization is restricted, the infection has a chance to transform, as it has in South Africa and Brazil, making new variations that are more contagious, which can spread abroad. Researchers dread they could be more impervious to existing immunizations and in this manner undermine nations that have had a fruitful rollout. Strong cost. The UK government says there'll be freedoms to think back, break down and reflect. There will be an autonomous request, at the fitting time. In any case, for the time being it is centered completely around the pandemic, which has tested well-being frameworks across the world. As work keeps on conveying the antibody internationally, it shows up we have at last turned a corner in our battle against the COVID-19 pandemic. Professor Dale Fisher says we can't chance not learning the exercises of the most recent year. We've been hit hard and followed through on a robust cost. One of the most exceedingly terrible things we can do is the point at which this is finished, we simply return to ordinary. Assuming you don't gain from it, history will rehash the same thing.